good morning or good afternoon, depending on where you are joining us from. And welcome to the first webinar in our three-part School Medicaid Matters webinar series. It's so wonderful to see so many people joining this webinar today. My name is Rochelle Davis, and I'm the founder and president emeritus of Healthy Schools Campaign. For those of you who are not familiar with Healthy Schools, just a few words about us. We're a national organization working at the intersection of education, health, and equity. We're based in Chicago and draw on our work with Chicago Public Schools. We are multi-issued with a focus on policy and system level change to promote healthy schools. And Healthy Schools Campaign is a leader in supporting school health services and for sufficient sustainable funding, including through Medicaid. When we started this work, I never would have imagined we would be where we are today with recognition and major investments in school Medicaid from both Congress and the Biden administration. It's very exciting to see this significant momentum for school Medicaid. It is my hope that our discussion today and over the course of this series will build upon the progress made so that we can leverage the full potential of schools to support student health and wellness and address the youth mental health crisis. We are so fortunate and grateful to host this webinar series in partnership with two incredible national organizations, Community Catalyst and the Georgetown Center for Children and Families. And finally, I want to express my many thanks to Vicki Wachino for joining us today as our keynote speaker. It is such an honor to work with you all. I am now delighted to hand things over to Healthy Schools Campaign's National Program Director, Jessie Mandel, to provide a brief overview about school Medicaid and our agenda today and to introduce our speakers. Thanks again for joining us.
Thank you so much, Rochelle. Hello, everyone. It's so exciting to see so many people joining today. My name is Jessie Mandel. I'm the National Program Director at Healthy Schools Campaign, and I'm just so thrilled for the conversation today. Before I introduce our speakers and today's agenda, I want to provide just some very brief context for our conversation today. First, I want to ground us in the many reasons that school-based health services are so important, as you will be hearing from our speakers too. School-based health services are critical to advancing equity, improving access to health and wellness, and reducing the barriers to healthcare many students and their families face. School-based health services allow for early identification and intervention of health issues, and school health services are linked to better health and academic outcomes, keeping kids healthy and learning. Now, there are many different models for delivering health services in schools, but for the purposes of our presentation today, we are focusing on providers who are employed by or contracted by school districts to deliver services in a school setting. To be clear, all models of delivering or financing services in schools are important, but our focus today will be on school employed providers, and this is where Medicaid plays an especially important role. For more than 30 years, Medicaid has played a role in paying for physical and behavioral health services in schools. All states have school-based Medicaid programs which are unique to their state, but in general, Medicaid can pay for school health services delivered to all Medicaid-enrolled students in a school setting, subject to certain rules. Now, if you would like a more foundational understanding of just how Medicaid can pay for school health services, and how states are leveraging in this funding. Oh, next slide, please. If you'd like a more foundational understanding of just how Medicaid can pay for health services and how states are already leveraging this funding, please join us for the second webinar in our series, in our three-part series. And then in April, we will discuss how to get involved, no matter what your role is, and how to advocate for school Medicaid. But now on to today and a look at the unique moment we are in for school Medicaid and what lies ahead this year. We have an exciting agenda for today. First, we'll hear from Orla Kennedy, Senior Policy Analyst for the substance use disorders team at Community Catalyst, where she advocates for policy changes to improve substance use disorders treatment and recovery support services. We have Ann Dwyer next, Associate Research Professor of the Practice with the Georgetown University Center for Children and Families, where her research and policy work focuses on Medicaid and the Children's Health Insurance Program, including behavioral health. And we have Margot Johnson-Green, who will be joining us for the panel discussion. Margot is State Health Policy Analyst, also with the Georgetown University Center for Children and Families, where her focus includes school health and Medicaid. Finally, we are thrilled to have former CMS Administrator Vicki Wachino to discuss federal school Medicaid momentum. Following her keynote remarks, we will have a moderated discussion with the speakers, and then we'll have an audience Q&A, which will be your time to ask questions. As a reminder, anytime you can submit your questions to our speakers through the questions box feature, the Q&A box, and you can also share questions or comments via the chat, which I can see everyone is already doing. And with that, I will turn it over to Orla.
Thank you so much, Jessie. Can I get a thumbs up? You can hear me okay? Perfect. All right. Well, thank you so much, Jessie, and welcome everybody to today's discussion. I'm Orla Kennedy from Community Catalyst, and I'm based in Boston. And we're going to start here with kind of continuing the framing that Jessie outlined in the intro, just to give kind of a snapshot of the growing mental health and substance use crisis among young people that we're facing in the country today. And so we're seeing lots of attention at the federal level regarding the crisis. We had American Academy of Pediatrics and others declare a formal national state of emergency. We saw the Surgeon General put out a big report on protecting youth mental health. We've got the CDC putting out the data, and then we see it also being covered in mainstream news outlets. And so on the one hand, great that attention is being drawn to the issue, and also at the same time, it is a growing crisis that we are working toward trying to combat. And so that's what the context is bringing us all together today. So on to the next slide, please. And really, this is just a couple of data points, and I'm sure nobody here today needs to be convinced just how big the problem is. But overall, we do continue to face this youth mental health and substance use crisis. Youth overdose deaths are rising faster than the rate for the adult population. Suicide is among the top 3 leading causes of death for youth and adolescents aged 10 to 24. And there's huge treatment barriers. Just 20% of children with behavioral health needs are able to get the care they need from a mental health provider. And of course, COVID, like many things, has made all of this worse and has increased the need, in particular for marginalized youth. So youth who are LGBTQ or BIPOC youth, and it's Black, Indigenous youth of color. And so it's really, really contributing to the crisis. And adolescence, especially for addressing behavioral health conditions, adolescence is really a critical time for preventing and treating mental illness and substance use disorders. And youth are actually more likely to access services and complete treatment when it's in a school-based setting. And so that's another context for our discussion today about the opportunity to see schools as a way to meet students where they're at, meet young people where they're at, and to try to provide them the services that they need where they need them. And so with that, I will turn it over to Ann Dwyer with the Georgetown Center for Children and Families.
Thank you so much, Orla, and a great welcome and overview from Rochelle, Jessie, and Orla. It's great to be with you today. As Jessie and Orla mentioned, I'm Ann Dwyer. I'm an associate research professor at Georgetown University Center for Children and Families. At CCF, we really focus on policy development and implementation related to Medicaid and CHIP to improve access to high quality, comprehensive, and affordable health coverage for children and families. And with over half of children covered by Medicaid and CHIP, and as the single largest payer of behavioral health services in the US, we know Medicaid can and does play a critical role in meeting the needs of students and ensuring that they can show up to school healthy and ready to learn. Yet we also know that fewer than half the states have expanded their school Medicaid programs. Fortunately, however, we are seeing lots of renewed interest and action at both the state and federal levels in expanding school Medicaid to support student health, including mental health. So on this note, I am particularly excited to introduce our speaker today, Vicki Wachino. Vicki is well-versed on school Medicaid, having spent more than 25 years advancing healthcare policy for low-income individuals and children. She twice served as at the Centers for Medicare and Medicaid Services, working to advance policy and operations at Medicaid and CHIP, including as Deputy Administrator from 2015 to 2017. This is really no small feat. In fact, it's an incredible feat, in fact, given that Medicaid and CHIP are responsible for providing health coverage to tens of millions of Americans, including over 91 million individuals today. So among her many activities as Deputy Administrator, Vicki oversaw the development of the first federal regulations establishing mental health parity in Medicaid and CHIP. As Principal of Viaduct Consulting, Vicki currently focuses on public health, behavioral health, and the criminal justice system. And as I know we'll learn more about shortly, has a keen pulse on the latest on federal actions and momentum on school Medicaid. So with that, I will turn it over to Vicki. Thank you.
And thanks so much for that introduction. And thank you, Orla, Jesse, Rochelle, and everyone for having me here. I would have a hard time identifying 3 organizations nationally that have done more to deliver for kids than Healthy Schools Campaign, Community Catalyst, and Georgetown's Center for Children and Families. So it's a real privilege to be here with all of you, and exciting to see all of the places from across the country that people have joined us from today. Thank you so much for being here and being part of the conversation about delivering for kids, because as you've already heard, the need to deliver for kids right now is urgent. And what I would like to do with you this afternoon is to just offer my take on what's happening at the federal level, what the new policies mean, and why this moment is extraordinary. And I choose that word very judiciously. We are very, very much in an unusual moment. And I hope that by being here today, this is either the start or part of your ongoing efforts to turn these new policies into transformation for kids in the United States. I'll speak both from my perspective working with HSC, my perspective doing some recent work on mental health, and also my past experience working at CMS. And I will start with the next slide. So if we could just start right there. And I just wanted to start a little bit with the why, and this probably goes without saying. But really, I think the reason that we're all gathered here and the reason that there has been so much attention at the federal level as well as at the state and local level is that we've got such a clear ability and opportunity to really deliver for kids. Orla's already said this, we need to meet kids where they are. We need to bring the services to them. And if we do that, we have the opportunity to advance some very key national goals around educational readiness and educational success, around the health and well-being of students, and around mental health. Because as you've already seen, the need for mental health services for youth is absolutely critical right now. And I will say, and invite you as you do your work to bring a particular focus to low-income children, because we know that they face the largest barriers to care. We know that during the pandemic, their school performance was set back the most. We know that they are more likely to have lost a family member to COVID. And we know that they are struggling in many places in the country. And we also know that focusing on low-income children can be part of the key to unlocking equity in the healthcare system and the educational systems. And that really leads us to Medicaid. There are a lot of ways that we can provide and finance services in schools related to healthcare, but there's only one that gives us certainty that we're going to deliver for low-income kids, because as you've heard from Anne, Medicaid and CHIP together cover half of the children in America. So when we focus on Medicaid, we deliver for low-income children. And then the other key point about Medicaid is it is a path for sustainable financing over the long term. Local funding is great and we should provide it. State funding as well. Federal grant funding also key. But really where Medicaid comes in is delivering for the long term and providing sustainable financing so that as you, whether you are in a school building these services, whether you're in a health agency, a Medicaid agency or a public health agency, or whether you're an advocate, I think you want to know that the time, what you're building and what you're spending your time on is going to be there for the long term. And I think that that's the moment we're in. We have the opportunity to build upfront now and meet the moment. And the moment is condition critical for many kids. And I think we also have this opportunity to build for the long term. And if you look at the trajectory of Medicaid and the way that Medicaid has had an impact on children, we know that when kids get Medicaid coverage as kids, they are more likely to grow into healthy adults, more likely to go to college, and more likely to have higher earnings. So it's an incredible moment and opportunity that we all have to deliver for some of the kids who need it most. Next slide, please. I want to provide just a little bit of history and then talk about what's unique about this moment. So as you've already heard from Jessie, it's not new that Medicaid can cover some healthcare services in schools, but for many years, the ability to do that was really limited to kids who had individualized education programs. So kids with significant disabilities or other issues that needed a lot of help. And in 2014, the CMS took a hard look at this policy and what it was going to take to help advance progress on school Medicaid and revised a longstanding barrier called the free care rule. And we won't go into the specifics of that rule or even the policy change here, just to note that it really opened the door for providing for Medicaid to cover services for all kids who are Medicaid and CHIP eligible in schools, and to broaden the number and type of services that they have. And since 2014, so over the past nearly 9 years now, there's been good progress. We've seen a lot of states taking up this opportunity to go beyond the IEP and provide broader Medicaid coverage, but only 18 states. And as Anne, you heard from Anne a second ago, that's not even half. It's not even close to half. And so I think that there have been a lot of people, including people on this call, who were wondering long before the pandemic, long before the youth mental health crisis, how do we move that needle? But what the pandemic really precipitated is attention to how to meet kids' needs. The pandemic coincided with a youth mental health crisis. And let's just linger on that point for just a second. The pandemic did not cause the youth mental health crisis. The youth mental health crisis really, if you look at the data, began in 2011 and has increased till now in very, very alarming ways. And then, of course, the pandemic created additional disruption in the lives of children and families and schools. And what that has precipitated is a lot of attention at the federal level about what do we do about this and how can we better deliver for kids. And it became, I think, very natural for policymakers to look to Medicaid and look to schools and say, how do we do more? And so before we get to the specifics, I just wanted to review the recent history of the focus on school Medicaid. So a year ago, nearly in March, the secretaries of HHS and education made this commitment to school health, school mental health, and Medicaid coverage. They sent a letter to all states and they followed it up in July. And I thought that was a very exciting development at the time, and it was, but it wasn't nearly as exciting as what happened in June, where after bipartisan committees in Congress took a look at mental health, the Bipartisan Safer Communities Act, the gun safety legislation, included substantial changes and improvements to school Medicaid, which we'll just talk about in a second. And then in August, CMS issued guidance, and just this week, as part of the rollout materials for the President's State of the Union address, school Medicaid was identified as a key way of advancing kids' mental health. And commitments were made to issue new guidance from CMS, HHS, as well as from the Department of Education. And so what I think is remarkable about that are two things. One is it's very unusual for an issue around schools and health to make it into the aura of the State of the Union. But perhaps even more unusual is that you have both leadership at the highest levels of government in the federal executive branch and bipartisan interest in Congress in these issues, and not just interest, action. So really, if you think about it from a political and policy context, the stars have aligned very, very well around school Medicaid and given us all this ability and opened this window to move forward for kids. Next slide. So let's talk about what that energy and attention is translating into in terms of actual federal actions. The Safer Communities Act that I just mentioned requires three things, and I call this the school Medicaid trifecta, and I'll tell you why having all three of them is important in just a second, but let's just review the basics. First, CMS is required to issue new guidance on school Medicaid, simplify policies, remove barriers, and help advance best practices. They issued guidance in August that basically clarified the rules of the road, but this guidance is designed to be a little bit more forward-leaning and a little bit more specific to try to move the needle on kids' health. Now, when I was in government, probably that's as far as we would have gone. We would have done the guidance. But Congress, I think, very wisely recognized that to really move the needle on these issues, it couldn't just be CMS issuing guidance. So they also provided a technical assistance center so that CMS and ED can actually support states in doing this work, and $50 million in planning grants to states. And so this is the trifecta: new guidance and the tools to actually translate that guidance into reality. And having all three of those is very, very unusual. My perspective when I was running the Medicaid program at CMS is, and this was a humbling experience, as so much of federal service is, you spend a lot of time trying to develop new guidance. You spend a lot of time looking at the barriers and figuring out how to remove them. And then you put the guidance out and you're not sure that anything ever happens because really the work is at the state level and at the local level. And so these grants to states and the TA Center, I think, are really designed to help the field, to empower CMS to support yours and other efforts to advance school Medicaid, and to give states these $50 million in resources to help accelerate progress and give people in the field that are doing the work the resources directly to make it happen. Now, I will tell you a story that does not, that is a little bit embarrassing, but I'm going to share it anyhow. A year ago, Rochelle and Lena called me and said, you know, we really see a moment on school Medicaid here. We, think CMS is interested, and we think it would be really great if CMS also created a TA center. And I said, I agree with you that that would be great, but I have got to tell you that is a heavy lift. It is going to take a lot for CMS to find the resources for this, and it could take years to get CMS to establish a TA center. And so that was in March of 2022. In June of 2022, the TA center became law. So it shows how much I know and am able to predict the environment, but I think also underscores the unique focus that Congress and the administration are bringing to these issues right now. Next slide. And so, as exciting as all of this policy momentum is, I'll cut to the chase and say it is not going to happen without you. All CMS can do is to really set the table or establish the playing field. Choose your metaphor, but to really make the most of the moment requires people like you working at the state and the local level to make it happen. And from my perspective, that's great news, because I know how committed you are to kids. And I know that as you do this work, you will put your shoulder to the wheel and really be guided by a vision of how to translate these promising new policies into action. And into better outcomes for kids. So before I close and we go to the panel discussion, and I'm very much looking forward to your questions, I just wanted to offer a few thoughts on what can be done right now, and understanding that you are all waiting for additional guidance from CMS, and what they have to say will be very important to your efforts. I want to urge you not to wait to hear what CMS has to say, but to really try to move the ball forward now. And so my suggestions are, A, if you are not already up to speed on Medicaid, if you're not already Anne or Margot or Orla or Jessie or Lena, who have spent years focusing on these issues, take this time to scale the learning curve and get to understand Medicaid's basics. What does it take to become a Medicaid provider? What is Medicaid's pediatric benefit, EPSDT? How is this all going to actually work? And then collaborate. So I think one of the keys to success of these new policies is that there are going to have to be cross-cutting teams at the state and in many places in the local levels, comprised of, at a minimum, state Medicaid agencies, state education agencies, and LEAs. And I encourage you to do that. I'm also mindful of just how hard collaboration could be. And so I'll share another observation I had, or experience I had from my time at CMS, which was that we established a TA project on health and housing. Clearly, housing is essential to health. And so we decided that we were going to start an initiative just to advance the ability of housing agencies and connections between housing agencies and Medicaid agencies to link together. And we required the participants in that TA effort to apply for the process as part of state teams. So you had to have a Medicaid agency, a housing agency, some public health agencies, and then we brought them all to DC for a meeting. And I have to tell you that people who sat down at those tables together from the same states, in many cases, had never met. They did not know each other. And so just doing that, just starting to get people to know each other is a key element. And then you can learn together and start to build towards a vision for how to make these changes for kids. Build awareness among your stakeholders. Make sure your Medicaid director, your health secretary, your governor's office, your legislators know that this change is happening, that more guidance is coming, and that you are developing a plan to make it happen. And then finally, sketch out an action plan. Define your goal. What is it that you actually want to see happen in schools? Who else do you need to consult with to make it happen? How do you build awareness on the part of teachers, of parents, of the kids themselves? Because all of them are going to be essential to both designing a plan for success and to executing to that plan. And so start to sketch it out. Granted, there are things that you won't know until summer when this new guidance is scheduled to be released. But I would encourage you to write down as much as you know, and then just put placeholders for the questions that haven't been answered yet. And my hope is that that will put you in a great position to meet the critical need for health and mental health services that our children from now, we can all get together again and you can report out on the great progress that you're making. So thank you all again for joining and for the work that you are embarked on. And I will turn it over to the team to facilitate questions.
Vicki, thank you so much. Thank you so much for that. That was terrific. I'd like to now also invite Orla and Margot and Anne back up on the screen. We're going to just talk for a few minutes and then we'll have time for audience Q&A. So it's great to see those questions coming into the Q&A box and continue to do that. But first, it'd be great to just talk with you all. And Vicki, I just want to start off by thanking you so much for really putting that all in perspective. Really, it's an amazing moment and so much has happened and will be happening to get sustainable funding through Medicaid into schools to support student health. And as you said, it took a lot of work to get to this point and some luck, and but a lot of work. So my opening question to you is really, what comes next? What's one thing that you think everyone on this call, or a few things everyone on this call should do to help keep up this momentum and propel things forward?
Sure. I mean, great question, Jessie. You know, I think stakeholder awareness is so key, right? So first, just like building awareness, getting the right people to the table, around the table, as I said, and then starting to think concretely about the actual steps that state governments and LEAs need to take. What policies need to be changed? What needs to be resolved? What federal approvals need to be sought? Again, like where the rubber is going to start to meet the road is at the state level. And so starting to plan for what are the state actions that need to happen, I think would be a good first step. But Anne, Orla, and Margot, I'm sure you also have thoughts on this question. So, so please jump in.
Well, go ahead, Anne.
I mean, I think Vicki covered a lot of it, and I think you really touched about it in your remarks, but what we've kind of heard in states is really the coalition building, right? Of having a diverse group of stakeholders that really see the impact of expanding school Medicaid programs and what that can mean in their state. You know, obviously we work a lot with kind of state Medicaid advocates, but of course, working with community partners, with school partners, having that diverse coalition together at the table, working with the state, because as you know, some of you may know, it can be, you know, it's complex. School Medicaid, it is a complex process. And I think what we're hoping to see with the TA Center and the new guidance is maybe some streamlining of some of that and some just additional information to make it a little bit more accessible. But we know 18 states have expanded their school Medicaid program. So it's also really possible. And we're seeing more and more states take steps in that direction. So again, working with those diverse stakeholders can really, I think, have a meaningful impact as folks talk with their state agencies about taking up some of these existing flexibilities.
That's great. Thanks, Anne. Actually, Orla, I want to turn to you for just a moment too, because Vicki also talked about the importance of mental health and behavioral health, which of course you talked about as well in your opening remarks. I'm just wondering what your reflections are, or questions you might have for Vicki as well.
Yeah, thank you so much. Thank you so much, Vicki. Yeah, that was a fantastic overview. I'd like to build on kind of how you were wrapping things up in terms of kind of getting back to the process type discussion. And you had mentioned that really what's happening is CMS is setting the table, and now it's kind of up to folks on the ground to take that mantle and focus on what has to happen next. So could you say a little bit more about that process? So after CMS releases the guidance to states, what happens after that at the state level? What should folks be aware of?
Sure, great question, Orla. And of course, it varies by state. Every state is different, right? Some state Medicaid agencies are going to have to go and change a lot. in terms of their plans. Some are only going to have to change a little. So it depends. But I think the opportunity of the CMS guidance first is for stakeholders, and I define that term broadly, meaning other government agencies outside of the Medicaid agency and advocates, to go to the Medicaid agency and hold the guidance up. And you can use the August guidance too. You don't have to wait necessarily for the summer guidance and say, look, CMS has said this is a priority. Look, they have clarified the rules. Look, they want us to do this. And by the way, so does Congress. And by the way, so does the President of the United States, right? So like, you got to grab their attention. And I think I saw in the chat, there was someone from a state that's having a little bit of trouble getting some traction there. And honestly, that's not unusual. Medicaid directors have a lot going on at any time. And now, as Anne, Margot, and Orla can speak to amply, they're dealing with the expiration of the public health emergency, which has a lot of implications for who's enrolled in Medicaid, a lot of implications for the delivery system. It's a heavy lift. So you gotta like go in and grab them by the lapels and make sure they're aware of the moment. And then here's again where I think the stakeholders can be super helpful, is keep up the momentum. Don't go in and ask for one meeting. Ask for a series of meetings. Make sure they know you're serious and that you're going to be there for the long term. And critically, that you're going to be a partner who helps them do the work. I think it's always strongest to go in not just with an ask list, although you will have asks, but going in with a concrete sense of what you are going to carry, what you can contribute. So I would say clear vision, attention grabbing, sustained commitment, and really be a good partner. It's very easy, and I have been in this position of having people bring me really long to-do lists. And, as the policy official in those meetings, you sit there thinking, okay, I've got 10 free minutes in my day. I can maybe do half of one of the things on your list. But if you approach it more as, how are we going to do this together? And again, show the degree of stakeholder alignment, and be tactical. Do your homework before you go in. Read the guidance. Again, get up to speed and know how this works. And I think that can put everyone on the best path to suggest. And more directly to your question, if it's not obvious to you what the state needs to do to make this happen, ask them to spell it out for you. Ask for a meeting with the staff person who's actually going to have to make this happen, and just say, hey, walk me through this. What do you have to do to do this? Help me understand.
Thanks, Margot. Let me turn to you. I'm also seeing all these great questions coming in from the chat. We thought maybe there wouldn't be questions, and we realized that clearly we were wrong. But Margot, I'd love to hear your thoughts, because you work so closely with states in your role and with state advocates. So what other questions or lessons did you want to pull out or ask Vicki from those remarks? And what else would you like to mention?
Yeah, thanks, Jessie. And thank you, Vicki, for your remarks and your longstanding commitment to Medicaid. Everything that you just said is music to my advocate ears. I feel like this is what we're always advising for our state groups. So thank you for reiterating all of that. And I also wanted to thank you for the slide that you put up on action steps, once the guidance comes out, because we know this guidance has been a long time coming, and it'll be a lot of information for states to sort of digest and figure out what to do with. And so I think that, can sort of serve as a roadmap, and would be a really helpful tool. My question, which I have also seen come up in the chat a couple of times, which maybe it'll get at two parts of the question that I have. Is that you mentioned that one part of the Bipartisan Safer Communities Act was to have the TA Resource Center, and additionally the $50 million in grants. And I think both of those resources will be amazing for states to sort of try and operationalize the guidance. So my question is, one, if you could possibly opine on how you think these grants will be dispersed to states or used by states. And then my second question is in terms of the TA Center, What do you think would be the best use of it? Like, how would states best utilize and operationalize the TA Center once it's up and running?
Great questions, Margot. Thank you. And it's, there's no crystal ball on how these resources will be deployed. And no right or wrong way to do it. I think CMS has some discretion. And I would say that if you all have views on the way the grants can be allocated and the TA Center could be carried out, they are worth conveying to CMS. And I know HSC has done some thinking along those lines. With the grants, I mean, 50 million is a substantial sum for TA grants to states. And I think CMS will have to make some decisions about priorities with them. Do you want to do a larger number of states with smaller grants, or concentrate on a few states? Do you want to concentrate on some of the states that already have school Medicaid and help them make it broader and better? Or do you want to help states who are just getting out of the gate? So I think there's a bunch of ways that they can go with it, and probably we're not going to know until they issue the grants. It's typically the grant making process is pretty privately held, but I do know that if you provide thoughts to them about the best allocation, that it will be taken seriously. One thought I have offered to them, and I have no more standing at this point than any of you do, is that I think it would be great to award the grants to states that approach them in teams, kind of reflecting that kind of the need for cross-sector collaboration. I think that is a key success factor for the work. And I would love to see really using the grant funding to really encourage states to establish strong partnerships across agencies and sectors. Similarly for the TA Center, CMS has a lot of flexibility. I could see them identifying a set of best practices for states. I would love to see them identifying some state exemplars among the 18 states that have already done this, and to talk about what it is that they did, why it was successful. And also, I always find it sometimes is helpful to learn as much from the challenges and struggles and failures as it is from the successes. I would love to see CMS bring states together. I know that there are already learning collaboratives underway, but my experience working with states is, they don't get a lot of opportunities to talk to each other, and so like when you can get Ohio and Utah and Alaska in a room together and they find out how much they have in common as they try to achieve a common goal, like that would be a small part of the TA Center. And then I think there's also the question of like, do they try to drill down on just some specific topics that are very tricky, and can they provide toolkits so that states aren't reinventing the wheel 50 times? This is always a challenge in Medicaid. But honestly, like one approach to enrolling Medicaid providers probably works in the majority of situations. So I think it would be great to see them develop some tools and toolkits that states can just take off the shelf and use to build their programs.
Thank you. Those are fantastic ideas. And I do not doubt the weight that your voice carries. So if you suggested stuff to them, I'm sure that they will work at it. So thank you.
And what about you? I know we're going to start teeing up. There's as these questions are coming through. Shout out, by the way, to Lena O'Rourke, who is also a consultant on behalf of Healthy Schools Campaign, rapidly answering and working behind the scenes on the Q&A. So I know we'll be taking audience questions shortly, but what other thoughts or questions do you have thinking about some of the things we just discussed too, and also just drawing on your own, Medicaid and CHIP expertise?
Yeah. Vicki, I thought you made some really interesting points in your remarks about Medicaid being kind of a pathway for sustainable financing. So we know that, I think there was an Axios article maybe earlier this week, schools got a lot of kind of temporary assistance during, under COVID relief, under ESSER funds. There's even some additional grant funding outside of Medicaid that was provided under the Safer Communities Act. all of that funding is great, but it is largely temporary. Would love to hear your thoughts, for folks on the webinar about maybe how they can be thinking about building that sustainable infrastructure and just how Medicaid can really serve that role of sustainability in the long run.
It's a great question, Anne, because all of my remarks so far have focused on Medicaid as a financing source. But we are at the end of a real high watermark of grant funding to states. The education funds, the ESSER funds, as you noticed, mental health block grant funds through SAMHSA, HRSA, like there's just, as a result of the COVID response and the American Rescue Plan, there has been very high levels, higher than I would have expected, given my history of looking at grant funding, where you kind of eke out marginal increases each year historically, and now suddenly in response to the crisis, there's been a lot of grant money. And so my suggestion of the play to be had here is really strategically leveraging the grant funds. Of course, a lot of that money needs to go to meet immediate needs, but reserving some of it to start to build the infrastructure that's going to be required to obtain Medicaid financing. And Healthy Schools, with some of its partners, did a great report on this about a year or so ago, of using ESSER grant funds to build Medicaid sustainability. I think that is key to success. And so I would also encourage groups, as they're working at the state level, to look across funding sources and strategically leverage each source. I will say, from my experience at CMS, we would put out guidance on promising things for states to do, and states would routinely come to us and say, that's a great idea, but I have no upfront money with which to build the infrastructure to do that. And so what's unique about this moment is the grant funding is very flexible. And so there is the ability, the financial ability in a lot of places to kind of build that infrastructure, as well as to think strategically about using grant funds to pay for things that Medicaid can't. So broad interventions, public health interventions, interventions that are applied to all students are really more appropriate for grant funding. So if you can use Medicaid to pay for the actual direct services, it frees up that grant funding to achieve some of these broader objectives.
Thanks, Vicki. And we'll drop that link on the ESSER report that you mentioned about how to leverage Medicaid dollars and ESSER dollars together. So thanks for mentioning that. Let's now move to audience Q&A questions. And I will just say too, I'm seeing a lot come in and also around requests for additional resources or citations, and we will be following up after this webinar with all of that. So if we don't get a link in soon enough, just be aware that there's more to come after this webinar. But first, just a question that gets a little into the technical aspect, but I think it's going to be important to address. And this is, until the new guidance is released, is it reasonable to assume that CMS will provide answers to states on outstanding questions or approving state plan amendments or SPAs? It seems like there'd be this preference for CMS to hold policy changes until the new guidance is published, but what is your thinking, Vicki, on that?
That is a great question, and it comes up all the time. I think that for questions that are under active consideration by CMS as part of the guidance, that they will probably be a little reluctant to answer questions as one-offs until they've nailed down the specifics in the guidance. Just because they don't want to, answer it and then have a state go back and have to change everything. So I think a lot will be held for the guidance. I don't think, though, that they would hold off on approving a state plan amendment to wait for the guidance. I think if there's a state plan amendment that's otherwise approvable, like there's no reason to do that. I think it is possible the state might have to go back and make some changes later, depending on what the guidance says, but I don't think they would want to hold up progress in the meantime.
Great, thanks. Is there anything anyone else would want to add on to that? I think that covers it. So let's move on actually to another question in the chat, or it came through the Q&A. Vicki, I'm going to ask you this one too around providers and provider qualifications, because it was specifically around the school psychologist issue, which there's, which is a very hot issue right now. But how does CMS think about qualified providers for Medicaid in schools, and what belongs to CMS and what belongs to states in terms of who's controlling those decisions? And I will just add too that Colorado and Michigan have done a lot around figuring out school psychologists as a issue, and so we will certainly share more about that. But just more broadly, what would you want to comment on that?
Sure, that's great. I mean, there are requirements under Medicaid law that to provide Medicaid services, a provider has to be a Medicaid enrolled provider. And CMS in its August guidance was specific about what that requires. That wasn't new policy. That was CMS saying, here's what it takes to be a Medicaid provider. You have to have, for example, a national provider identifier, which is a national requirement. So all of those pertain. At the state level, though, there's a lot that pertains that is not a CMS requirement around licensure and certification. And so to really thread the needle of who's going to provide services, you kind of have to provide both. Thread the needle of both. You have to understand the state requirements as well as the federal requirements. But I do think that at the federal level, like just looking at the August guidance and what's required tells you a big part of the puzzle of what's required. One thing, and I know this doesn't apply everywhere, but I do think it's a very promising practice, is partnering with community providers to provide services. And this may or may not help in the school psychologist scenario, but I think can be especially helpful when you're talking about a kid who has needs that go beyond the classroom. And you really want the child to be able to receive the more primary care focused services that are most likely to be offered in schools, and the follow-up services that they're more likely to have in the community. And bringing a community provider into both settings can be a great way to establish that continuity of care. Plus, the community provider comes already having met the state and federal requirements over being a provider. So in other words, you don't have to build it all yourself necessarily. I think in some cases you can buy it from a service that's already outside.
Thanks for that. Is there anything anyone wants to add on to that? Great. Well, then we're going to shift just slightly, because we're seeing some questions coming around the public health emergency too. Which is one of the other looming Medicaid forces coming down this year. So as states are starting to think seriously about and plan for the public health emergency unwinding, especially that continuous coverage disenrollment requirement or freeze, do you see any opportunities as it relates to expanding school Medicaid? And I just jumbled what the PhD is about. So Anna, Margot, or Vicki, someone please feel free to correct what I might have misspoke. But as that's coming down, what's the opportunity for school Medicaid there? And Anna, Margot, I know CCF has done a ton on this as well. So also feel free to jump in.
Yeah, happy to start. So Jesse mentioned unwinding the public health emergency. So there was a important protection that has been in place during the public health emergency in Medicaid, the continuous coverage requirement. So individuals could keep their Medicaid coverage and had not had to go through renewals. That's going to be lifted this spring, and states are going to be starting renewals for individuals in Medicaid. And so, CCF has done a lot of work on what this could mean, potential possibilities for pretty major coverage disruptions, in particular for children. So we'll put in the chat a link to our CCF unwinding page. We have a 50-state tracker for those of you who are interested. If you care all about Medicaid or children's health coverage, this is perhaps the biggest coverage event since the creation of Medicaid. It is going to be a really big event. So ensuring that families are aware that they will be getting these renewal notices, that their addresses are updated, will be a critical component to minimizing coverage disruptions for individuals who are otherwise Medicaid eligible. So we'll put some of those resources in the chat. I think, as Vicki mentioned, one dynamic at play will be that state Medicaid agencies are going to be having, I mean, this is a huge undertaking for them. So this is going to be a huge focus, restarting the renewals, going through the unwinding of the continuous coverage requirement, as well as other kind of requirements they may have had under disaster spas or other flexibilities that existed during the public health emergency. But I think that being said, we are still seeing states that are really interested in, yes, we have to do the unwinding, let's put a lot of resources in here, but we are still committed to proactive policy making and ideas. I think most recently, the governor of Ohio put out a budget that talked about optimizing Medicaid. So we're waiting to learn more, but I think that we are seeing states that are still interested in a proactive agenda. And I think because Medicaid will be getting so much attention, and because we really will be focusing on the importance of coverage during this event, that you could leverage some of that to also talk about, okay, well, coverage is great first step. Let's make sure kids are getting their services, and we know that kids are in school. Let's see if we can ensure that they can get those services in the setting that might make most sense, and oftentimes that could be school. But before I kind of wrap up, I did want to turn it over to Margot on our team. Can maybe talk a little bit more about what's the role schools could play for any of those that are working with school partners on the webinar, or working with their school partners in terms of alerting families about the unwinding.
Yeah, thanks, Anne. I think that was a really great overview of sort of the urgency of the situation. And so we at CCF have been working with a few of our national partners, including the Center on Budget and Policy Priorities, and then also the Superintendent's Association, to sort of have a grab book of materials for school districts to use to help families prepare themselves for the unwinding. And as Anne said, one of the major messages to sort of bring down to families is to really make sure that state Medicaid agencies have the correct address information. There have been estimates that millions of children may, excuse me, may incorrectly lose coverage, even though they are eligible, because of these administrative and procedural reasons. That could be easily mitigated by making sure that folks have their updated contact information on hand, so that if those renewal paperwork do come down, it's coming to the right place, and then they can contact their state Medicaid agency with the information needed to continue their renewal and make sure that they are still eligible and covered by Medicaid. So those materials are in the works. Things that we have going now are a template letter to send to school district leaders to sort of lay out the lay of the land with the unwinding, and then also social media graphics, flyers to disseminate in the schools with sort of 3 easy steps to make sure that folks are ready to have their information on hand for when those renewals do come out, to make the process a little smoother.
Thanks, Margot. Vicki, anything else you would like to add about the unwinding and the impact on kids in this context of this webinar too?
The only thing I'll add is that in its August guidance, CMS went out of its way to point out the things that schools can do to help people enroll in coverage. And I think a lot of those practices, as Margot's described, can also help maintain coverage for families who are at risk of losing them as the public health emergency ends.
Thank you. Wow, thank you. There's much more to come, but I want to say, first of all, thank you so much to our panelists, to CCF, to Catalyst. You both will be back for our next webinar. So, so we're just really excited for that. But Vicki, thank you so much for everything you shared, and for just all the work that you've done on this area too. And over the years, I feel that, as you said, we're building a more sustainable system, and so I feel very excited about the future of school Medicaid and the future of student health. As we're wrapping up here, I do just I want to thank you all, and I we're going to be sharing a few very quick resources. I do just want to say also that I'm just so grateful for everyone, including many participants on this call who have advocated for increased investments. I know that we had even a former Healthy Schools campaign staff, Alex Mays, out there. There's just so many people that deserve shout outs that have been doing so much incredible work to get us to this moment. So thank you all for the work that you've done. So now I'm just going to very quickly mention a few resources that will flag, and of course there's many more that we're going to be collating from what's in the chat and also from what's been shared out. So we'll be putting those on our website very soon. But I want to mention that Healthy Schools Campaign also hosts the Healthy Students Promising Futures Initiative. Next slide, please. And this is where we bring and develop resources and tools specifically to support states in expanding and implementing school Medicaid programs. And so you can see here just this interactive map that has a wealth of information. We'll have the link, but it's a really helpful launching point to explore where your state is at and to identify the best path forward for expanding school health services. Next slide. So we have included links here. We'll include more from CCF, from others that have been in the chat. That bottom state data hub, it's fantastic. So I just have to give a shout out to that. It's really a terrific resource, as are all of these on the website. So on this slide, so we'll be sharing those. And finally, just a reminder, we do have our next webinar on March 2nd. We'll be diving into many of these issues that we touched on today more. These webinars, they really do have a little bit for everyone. So please be sure to spread the word and encourage your colleagues and partners to join us. And with that, thank you so much again. I just want to express my gratitude and thanks to Vicki, to Orla, to Anne and Margot, and to Rochelle for everything you shared with us throughout the day. Thank you all so much for coming together. And I'm so excited about the future of school Medicaid, and more importantly, the future of school health and the health of kids. So thank you so much. This is the moment, and let's move forward. Have a great rest of your day.